Welcome to Problematic. Today we have a conversation with Dr. Pat Luse. I had a great time talking with him, and I hope you enjoy it as well. Tune in every Wednesday to hear from someone who is solving a real world problem. And now, here's Dr. Pat Luse. Let's get started. So, who are you and what problem are you solving?
Hey, my name is Dr. Pat Luse. I am a chiropractic physician, a functional medicine provider, and the president and CEO of Tri-State Physicians and Physical Therapy Clinic. And my role in life right now is helping people solve chronic disease illnesses, which are plaguing America.
Awesome. And could you fill us in on your backstory and how you came to where you are now?
Well, believe it or not, I've been doing this for 4 decades now, so it's been quite a while. And I went through college at the National University of Health Sciences in Chicago, and I received my Bachelor of Science and Doctorate of Chiropractic degree. But during my training, I was always interested in natural health. I remember back in that day, I was reading Prevention magazine, which isn't as popular now as it was back then. But Jonathan Wright, a medical doctor, wrote an article every month in the magazine, and he used natural means to cure people's health problems. And I was just fascinated by that. So going through college, I took every course on nutrition and health and weight loss as electives that I could. And I did a lot of postgraduate work. And then after college, one more thing that happened before college is I got interested in helping people with weight loss. And that's just a huge, huge problem today. And in fact, if you can only solve one problem in America and you solve weight loss, well, you have helped the world tremendously because that's a big problem. So I got interested in that, and I continued to do that and expand my expertise. And we have developed a very, very good system for helping people now.
Okay, so could you tell us more about what the Tri-State Physicians is actually?
Yes, we are a multidiscipline clinic. So we have medical staff, chiropractic staff, physical therapy staff, massage therapist, and a lifestyle medicine program. So we kind of cover all the main spectrums, and it's pretty cool because working together as a team, there's basically no issues that we can't help people solve. And along the way with all of our departments, we try to push people to using natural means to resolve their health problems rather than drugs or more radical procedures.
Okay, so you have part of your business is the seven systems. Could you explain what that is and how it works?
So during my practice in 2002, I got certified as a functional medicine provider. And it was very good training. Now, functional medicine is basically getting the systems of your body to function optimally so you have ideal health. And after going through the training, I kind of broke it down a little different than other healthcare providers. I broke mine down into 7 main systems. And we can talk more about those systems later, but those systems basically determine everything about your health. Your
Oh,
weight, your energy, your hormones, your sleep, everything is determined by these 7 systems. And in functional medicine, there's some very elaborate and expensive tests that you can do to help determine how things are working. And it's just too complicated and too expensive, bottom line. So after getting my training, I was looking for simpler ways to get these systems working correctly, and I came up with the 7 systems plan, which is a simple way to evaluate each of those 7 systems and see how they're working, and then identify systems that aren't working correctly, and then optimize their function with simple proven steps. And I'll tell you the thing that has amazed me. It is so easy to get these systems working correctly if you do a few key things. So I had I had great success with that, I was having phenomenal results in my clinic, and I decided to write the book, The 7 Systems Plan, which became a bestseller for a short period of time. And then I decided to try to branch out and help people that weren't just in my office. So I put together an online course, which is the same course that I teach my patients in my office. In fact, I'm coming from my classroom here. This is where I
Okay.
teach the course.
Yeah.
And we have people now in almost every state in America and in 7 countries around the world that are
Wow.
benefiting from the 7 Systems Plan.
And how many people have joined your plan or your course?
Thousands and thousands.
Wow.
And we have some amazing stories. I just love my passion in life. I love God, I love family, and I love helping people have amazing health. And
That
your
is
body
awesome.
can do amazing things if you just give it what it needs.
So could you highlight or explain what the 7 systems actually are?
Yeah, so there's 4 main systems. Your structural system, that's your fat, muscle, and bone.
Okay.
Your digestive system, your delivery system, now that's your arteries, your heart, your nutrient transporters, and then your energy system, the system that creates energy in your body. So those are the 4 main systems. They have to be functioning correctly. And then you have 3 support systems. The communication system helps all of these systems communicate. Now that's hormones, nerves, and neurotransmitters. Your defense system, which defends the body and the systems from attack. And then lastly, the detox system, which just cleans up the mess all the systems make. So those are the 7. And there's simple tests to know if they're working correctly. In fact, I teach a lot of at-home tests that are free. You can do it going through my course. And then there's a few blood tests too that can be helpful, but it's not that hard. Even questionnaires can give you a good idea if these systems are working correctly.
Okay. So what actually inspired you to start the 7 systems?
Well, what inspired me, I was just looking for a system, and I wanted something that helped do what we've talked about, but I also wanted something that educated my patients. Because if you understand how important keeping your insulin down or keeping your vitamin D up is, and you understand what those 2 things do, then you can make tremendous improvements in your health. But there weren't programs out there that were comprehensive enough. So I came up with a training in my office that became an online training for people around the world. And it's just doing a lesson a week, 40 minutes. And I've found that if people are educated and then they do a few action steps. So every lesson, I'm going to give my patients a couple action steps to do. And if you do that, in 6 months, you have totally changed your health. You've totally changed your knowledge base, and you are tremendously healthier.
That's crazy.
If I could give you one story here. I had a lady join my course remotely, but she did have a relative in the area, so she was communicating with her daughter here, who's also doing my program. And she relayed that in 60 days, she was off all 4 of her diabetic medications. Now, that's unheard of. And her
Yeah.
blood sugar was running 90 points lower with all those meds gone because she was doing the 7 systems plan. It was running at 90, which is very good. The diabetes was basically resolved. And not only that, she was down 35 pounds and off 11 more medications, off 15 medications in less than 90 days, and feeling tremendously better. It just doesn't take that long if you give your body what it needs.
So are there any unexpected discoveries you made while researching for the 7 systems plan?
Yes, in fact, I have a whole video on that. I call it the aha moments, things that just I saw and it blew me away. And one of the things I saw was that if you do the right things, diseases that are considered incurable can frequently go away. Now, I'm talking about autoimmune diseases. If you go to most medical providers and say, hey, I got rheumatoid arthritis, can I ever get rid of it? They'll say, no, you need to be on immunosuppressant drugs the rest of your life. Well, we get people off the drugs and in remission from rheumatoid and many other diseases all the time. Probably the most amazing story I had was went clear back to 1990. And in 1990, I had a patient come in with a blocked heart artery. And it's the big artery that's gonna kill you. And he's taking nitroglycerin for the chest pain. His doctor wants to do an angiogram. He's overweight, out of shape. He's got a terrible diet. And he's refusing to do the angiogram. So I put him on the strictest version of my plan at the time. And he got better. He lost over 50 pounds. His energy went up. The chest pain went away. He didn't need the nitroglycerin. He went from only being able to walk a block to walk as much as he wanted with no pain. And after a year, he went out to Colorado and went hiking and hunting with his grandson in the mountains for a week. So he couldn't walk a block. A year later, he's hiking in the mountains. Now, when he got back from that trip, his cardiologist was concerned and said, we need to repeat the angiogram, which is an imaging of that heart vessel. And to his amazement, he found the blood vessel had opened up. Now, in 1990, that was unheard of. A couple years after that, they started doing imaging studies that show that this is possible. But after I got that report, I just had to sit back and say, holy cow, you can reverse artery disease? This is powerful. We just need to give the body what it needs.
So, on a different subject, on obesity in America, how big of a problem is it actually in the United States itself?
A huge problem. In fact, 78%, I believe now, and this number goes up every year, it's not going down, are overweight. And being overweight will impair the function of every one of your body's 7 systems. So if back when I was in high school, we had a couple obese kids in the high school, well, now you got 30, 40, or 50% of the kids that are obese. So it's not good. And it is entirely driven by our diet, number one. But there's lots of things that can cause obesity. You know, the weight loss drugs that are popular now, Ozempic, all these drugs, you can't turn on the TV without seeing these drugs. They are aimed at people that are overweight. And I'm extremely concerned with these. I've been following weight loss drugs for decades now. And you see them come, and then you see them withdrawn from the market. And I just have a strong feeling that's going to happen with these drugs because they are playing with your brain. They are mimicking hormones in your body and doing it at extremely high levels that your hormones are not supposed to be functioning at to cause these effects. And it can cause bowel obstruction, which can be fatal. There are fatalities from these drugs. There are long-term consequences. So there's better ways to do it than the drugs. And let me just give you one example of what you can do. Okay. So the drugs mimic GLP-1 in your body. It's a hormone that makes you feel full, and it slows down the emptying of your stomach. All right, those are good things. Your body naturally produces GLP-1 if you have the correct gut bacteria. If you don't have the correct gut bacteria, you're not going to produce GLP-1. You're going to be hungry all the time, and you're going to gain weight. So an easy, natural solution is to the weight loss drugs is get the key bacteria back in your gut so that you produce your own GLP-1.
So how do you actually get good bacteria and remove the bad bacteria?
What you eat is the main determinant. But sometimes I have to put my patients on a little program to wipe out the bad bacteria. and then we reestablish the good bacteria. And here's the other thing about it. There are thousands of probiotics you can buy out there. There's only 2 specific bacterial strains that have been shown to increase GLP-1. So what do I use in my office? I use one of those that helps stimulate your body to make GLP-1. And by the way, this key probiotic should be 10% of your gut bacteria. And most people don't know, you're supposed to have 3 pounds of bacteria in your gut. 3 pounds. Well, Americans don't have that because they wipe it out by taking antibiotics or drinking chlorinated water or using artificial sweeteners or lots of other things that destroy your gut bacteria.
So why do you go ahead?
The future of medicine is going to be in your microbiome, your gut bacteria. It is huge. You got to have it working for you.
Okay. So why do you think obesity is such a big problem in America compared to like different countries?
Well, if you look at the countries, they're all catching up real fast. China, significant obesity. Okinawa used to be the healthiest, longest living country in the world. Now they're getting obesity problems. And why is that? Well, McDonald's and other fast food industries came to Okinawa not too long ago. So it all goes back mainly to diet and what we're eating. And a lot of people think it's the sugar. If you want to know the most harmful ingredient in your diet, it is not sugar. It is a fat called linoleic acid. And that linoleic acid comes from vegetable oils, seed oils. And you go to the store and buy some vegetable oil. It is loaded with this omega-6 fatty acid, which causes havoc to every system that you have. So we got to cut the bad fats out. We got to add the good fats back in. If you use processed foods, if you eat fast foods, you're going to get a lot of this bad omega-6 fat.
So what are some of the challenges that you faced when you started building the 7 Systems plan?
I guess the biggest challenge is there's nothing like this. There's not a plan out there that simultaneously helps to get each of the body's 7 systems functioning correctly. So I was looking, and I finally just decided that it's not there. There's nothing like this, so let's put it together. And the more I got into it, the more excited I got because of how powerful this is.
And like, how do you envision the future of the 7 Systems, like growth or potential wise?
Well, it is growing quite rapidly, and here's kind of the next phase. After developing the 7 Systems plan, I started getting invited to provide training to healthcare providers in different states. So this year I've already spoken at 3 training events for doctors, and I speak to hundreds of doctors every year. But they get excited about this too. And a couple of years ago, I started having doctors ask me, hey, how do I incorporate this into my practice? So we came up with a training program to get healthcare providers up to speed on how it works, and we provided all the material needed. And now we have over 100 different 7 Systems healthcare providers in the United States. They are in 13 states right now. And it's just growing rapidly. Last week, we added 2 more providers, and that continues to grow. And it's really exciting because I'm seeing them have the same results that I have.
That's really, really good. And then more of a controversial question, maybe not, but what's your opinion on modern medicine?
Well, modern medicine is totally going in the wrong direction. Just look at weight loss, for example. They want to give you an injection that you will have to take the rest of your life to control your weight. If you get off of that Ozempic or other weight loss medication, if you stop your weekly injections, the studies show your appetite comes back in spades. Well, that's not going to keep your weight very long. So
Yeah.
there is a need for crisis intervention medicine, and the medical facilities are very good with that. But as far as just helping people get to health and maintain health, it's not there. I mean, our healthcare system is profits entirely by people being sick. If people are well, then there's no money that goes into the healthcare system. So there's no incentive to change that, unfortunately. I do see a stronger and stronger movement in America. A lot of doctors now are getting into functional medicine and are learning about it. And I think it is going, but it's just unfortunately changing too slow.
Okay. And are there any misconceptions that you've seen in the health and wellness area in the United States?
Yes, there are a lot of misconceptions out there. And I would say, here's what I tend to do. Let's focus on the really big things that your body needs, that your systems need. Let's focus on those things. Let's provide those things, and then we'll see if other things are necessary. Every day there's a new product, a new machine, a new gadget, something that comes out that is a miracle whiz bang thing. Well, those things, some of them are okay and some of them aren't, but let's again just focus on the basics, fixing each of these systems so that things work correctly.
Okay. And what advice would you give to somebody that's just starting to work on their body or their health? And like, what advice would you give for them on their journey to better health?
I would suggest they continue to get educated. So listening to your podcast, they're going to get some great information. If they want to read my book, The 7 Systems Plan, they could get some great information. Going through my course, my online course, provides a tremendous amount of good information. The more educated people are on their health, the better health choices they make. Let me give you one example.
Go ahead.
If I tell you, Devin, you ought to be taking vitamin D every day the rest of your life, you might believe me and you might start taking vitamin D. But you're probably going to quit taking it eventually. Now, if I tested you and I showed you your vitamin D was extremely low, and then I showed you all the consequences of having low vitamin D and all the benefits of having vitamin D at optimal level, well, you'd probably take that vitamin D the rest of your life.
Yeah.
So it's the same with everything. If you understand it, if you know the importance of it, or on the opposite side, if you know how harmful taking in omega-6 fats are, you would probably really try to cut that down.
So how could someone actually improve their D3? Is it through vitamins or foods, or what do you recommend?
You will never get enough from the food you eat. Extremely, extremely difficult. How can you get enough? Sunlight. So, Devin, if you get 20 minutes of full body exposure to sun every day, you don't need to take vitamin D. Now, what's this full body mean? It means you're naked out there. You got to expose some significant skin. And if you're in the northern latitudes like I am, 6 months of the year, you're going to get no vitamin D from the sun. So you got to supplement for that period of time. If you're down south, you can get enough vitamin D if you take your shirt off and if you wear shorts. You got to expose some skin. So that's how you can get vitamin D. But most people don't expose. They're afraid of cancer, which I think is overblown. They wear sunscreens. They don't take off their clothing, and they don't get any vitamin D even if they're in a warm climate.
Is there any brands or businesses that you'd recommend for D3?
Yes. I looked for a long time for a great supplement company, and I finally found one. They have great products, and they have a very good price point on all of their products, and they're cutting edge on the things they come up with. So I actually made a link on my website, 7systemsplan.com. where people could go and purchase supplements, and I get them at a significant volume, so I'm able to decrease the price that patients pay for these significantly. So I make it real easy. They come right to people's door. Nutridyne is the company I really like. It is a great supplement company.
And then back on the topic of education, like, is there any specific books or podcasts or resources that you've really enjoyed in the past?
You know, I have read hundreds and hundreds of books over the years. I've got a library just full of books, and I do read a lot of newsletters. So Dr. Hyman, Mark Hyman, medical doctor, functional medicine provider, he's got some great material and great books. I like his stuff and a newsletter. Dr. McCullough has a great newsletter. It's a little technical for some people, but it's a great newsletter. Jason Fung wrote the complete book of fasting. Very good book. He's kind of the fasting expert. And I'll tell you, if people aren't familiar with plans that mimic fasting, like intermittent fasting or time-restricted eating, they need to get familiar with those. Those are extremely powerful tools to regain your health, and they are incorporated into the 7 Systems plan. When I put my plan together, I kind of took the best parts of the Mediterranean and the whole food and the fasting plans, and I combined them all to come up with the best of the best, in my opinion.
Cool. That's awesome. And so do you have advice for other people kind of like you who are starting out and they're trying to solve like a real problem in the United States or the world?
Yeah, I would encourage them to just stay on the journey. And it doesn't always happen overnight. You know, for me, it took a couple decades before it all started to kind of come together. But once it did, then it really took off. So don't let your dream die. Keep pursuing it. Continue to look at what's out there, what's working and what's not working, and then continue to experiment. And eventually, it can be very rewarding and very, very helpful to a lot of people.
Okay. So how can listeners find you and get involved and support your mission or find the 7 Systems plan?
There are many ways you can do that. My website, 7systemsplan.com, has a great amount of resources on there. So you can look at things. You can sign up for my weekly newsletter. I write a tremendous newsletter every week. It's free for people. So if you give me 6 minutes a week reading my newsletter, you will be educated. You get one every week for over a year, and there's lots of great topics on there. I cover everything in my newsletters. That's one thing. You can go to YouTube and search for the 7 Systems Plan, and then sign up for my my YouTube videos. Every week I produce a 5 to 8 minute video that is dealing with something that is cutting edge. So I just finished a series on the weight loss drugs and beneficial alternatives, helpful alternatives, natural alternatives to these weight loss drugs. So
Cool.
they can watch that. If they really want to get into it and change their health, the best way to do it is to go through my online training. And if you go through the online training, you can actually join me live right here in my office when I teach this training.
Cool. Well, thank you very much. It was an awesome show, and I appreciate you coming on.
Well, thank you, Devin. It's been great being here with you.
Yeah, thank you.